Hello everyone, welcome to Homeovision. Myself Dr. Naveen, practicing homeopathy in Bangalore. Today we will discuss one more important homeopathic remedy often used in our clinical practice. The remedy is Hepar Sulphur. Hepar sulphurus calcareum. Dr. Ibinash says this remedy is standing halfway between those two great antisoric, calcarea carb and sulfur. It has some very strong characteristics which guide to use in variety of ailments. In this video, we will discuss the general introduction, guiding symptoms, mind symptoms, and particulars including eyes, face, throat, respiratory system, GIT, urinary system, and skin complaints of Hepar sulphur. Coming to general introduction, the remedy was proved by our master Hahnemann. Chemical name sulphurate of lime. Miasm, it's an antisoric remedy. Thermals, chili, and diathesis, scrofulous diathesis. This is for remembrance of the remedy. The letter H, it covers many symptoms such as hypersensitive, hyperimpulsive, heavily sweating, hasty in speech and drinking, hoarseness in the morning, heat amelioration, and chilly patient. By this, you can easily recall the important points of Hepar sulphur. Next, coming to guiding symptoms, there will be hypersensitiveness to touch, pain, and cold air. The patient is so sensitive to pain that she can faint away even when it is slight. Extreme sensitive to cold air, the patient imagines he can feel the air if a door is opened in the next room. He must be wrapped up to the face even in hot weather. The other remedy is sorinum. The Hepar patient sweats profusely day and night without relief. The perspiration, which is sore and offensive, and easily on every mental or physical exertion. The other remedies are sorinum and sepia. Tendency to suppuration, which is most marked. Hepar may often open the abscess and hasten the cure. The slightest injury causes suppuration. The other remedies are graphitis and mercury. There will be sensation of a splinter, fishbone, or a plug in the throat. The other remedies are argentum nitricum and nitric acid. Cough when any part of the body becomes uncovered, baryta carb and rustox. This point can be asked in the AIPGT or next exam. Longing for acid things, vinegar and wine, and there is a aversion to fat food. Next, coming to mind symptoms. The Hepar patient is oversensitive both physically and mentally. The slightest causes it irritates him. He is quick, hasty in speech and hasty in drinking. Hasty means quick or a hurried manner. The Hepar patient is anguish in the evening and night. Anguish means the patient suffering in a severe mental or physical pain, agony. There will be a thoughts of suicide. Patient is peevish, angry at least trifle, hypochondriacal, and unreasonably anxious. Next, coming to particulars, we will discuss the symptoms of eye. There will be purulent conjunctivitis with marked chemosis. Chemosis means it is a sign of eye irritation with swelling and redness of the eye and eyelids. There will be profuse discharge with a great sensitivity to touch and air. Eyeballs sore to touch, pain as if they would be pulled back into head. Eyes and the lids are red and inflamed. The complaints of face. There will be a crack in the middle of the lower lip. The other remedies are ammonium carb and natrimur. I have given a natrimur in one case where the patient complains of high fever with crack in the middle of the lower lip. I give natrimur 200 along with FP6s. The patient cured within 2 days. There will be neuralgia of right side extending in streak into the temples, ear, alley and lips. Next, coming to throat symptoms. When swallowing, there will be a sensation as if a plug, fishbone, or a splinter in the throat, quinsy with impending suppuration. There will be stitches in the throat extending to ear when swallowing. The patient always hawking up of the mucus. It is the important symptom. Next, coming to respiratory system. Cough when any part of the body is uncovered. The other remedy is Rustox. Cough aggravated when exposed to dry, cold wind, eating anything cold, or when walking. There will be hoarseness with loss of voice. There will be asthma with breathing anxious, wheezing, and rattling, and the breathing is short and deep. Threatens suffocation, must bend head back and sit up. Croup. After exposure to dry cold wind, deep rough barking cough with hoarseness and rattling up of the mucus. So what is croup? Croup means laryngotracheobronchitis. It is an upper airway infection that blocks breathing and it has a distinctive barking cough. We will discuss more about respiratory complaints in upcoming medicine part videos. Next, coming to GI symptoms. There will be longing for acids, wine, and strong tasting food, and there is a aversion to fat food. Diarrhea, which is more marked in children, which is sour smell. The other remedies are calcarea carb and mac carb. There is also a clay colored soft stool. Next, coming to skin symptoms where Hepar act prominently. There will be slightest injury, it causes suppuration. The other remedies are graphitis and mercurial. In diseases where suppuration seems inevitable, Hepar may open the abscess and hasten the cure. The skin is very sensitive to touch, cannot bear even cloths to touch affected parts, the pain often causing fainting. Ulcers, herpes, surrounded by a little pimples or pustules and spread by coalescing. There will be chronic and recurring urticaria. Next, coming to urinary system. Urine, the flow is impeded and widened slowly without force and it drops vertically. There will be a weakness of the bladder and it is unable to finish. Seems as if some urine always remains. The other remedies are alumina and silicea. There will be a bladder difficulties in the old man. Next, coming to modalities. The complaints are aggravated from dry cold wind, cold air, slightest draught, touch, uncovering, abuse of mercury, and lying on the painful side. The complaints ameliorated in the damp weather, warmth in general, wrapping up warmly, especially the head, and after eating. It's a major remedy. You can get a questions of the guiding symptoms of Hepar Sulph and particulars, mainly the respiratory complaints, throat complaint, and skin complaints of Hepar Sulph. Thank you. Follow us on Instagram, like and subscribe for future reference. Thank you.